It's been a month since President Barack Obama blasted Congressman Paul Ryan's budget proposal at George Washington University for cutting $4 trillion out of the national deficit.
We are presented with a vision that says the American people, the United States of America, the greatest nation on earth, can't afford any of this.
Many of the points Obama raised have become talking points for his supporters on the left. Ryan says those points are distorted and deceitful, and he can argue that point by point.
A 70% cut in clean energy.
Well, first of all, clean energy is corporate welfare. That's the way we see it, which is we're picking winners and losers in the marketplace. We're raising prices of gas and carbon energy by regulating it, this whole idea to have cap and trade, and then picking winners and losers in the clean energy marketplace we don't think is good public policy. We want to get rid of all these subsidies for all kinds of energy companies, get rid of the corporate welfare, drill for oil and gas in our own country, so we're less dependent on foreign oil. We create jobs here, and we can get this out of the ground in a very environmentally safe and friendly, sensitive way, and we think that's a better energy policy. And then take all the money that we have, that we will get from all this domestic oil and gas exploration, dedicate most of it to the deficit and some of it to basic research so we can innovate and research our way out of this problem, this energy problem we have, instead of picking winners and losers in the marketplace, which I think green energy is just a new form of corporate spending that's come through Washington.
A 25% cut in education.
I'm not sure where he gets this, only that we had an over 200% increase in the Department of Education's budget if you add the stimulus spending in it. So if you take a look at the enormous gusher of spending increases we got from the federal government over the last 2 years, we're bringing spending back down to where it was before 2008. And so yes, spending went on an enormous increase over the last 2 years. We're simply saying, I don't think the government was horrible in 2007 or 2006. We're bringing all areas of spending back down to where it was before the spending binge began. And so yes, we're not keeping spending at these enormously high elevated levels that the president has.
A 30% cut in transportation.
Yeah, so some of these numbers I'm not even sure where the president has, but the president is proposing a massive gas tax increase. We don't propose a massive gas tax increase. So therefore, if we're not accepting his massive spending and gas tax increase, then I guess that is a cut. The new definition, or the old definition in Washington, I should say, is if you're not increasing spending as high as somebody wants, then that's a cut. We're simply bringing spending back down to where it was before the spending binge began, starting in 2008.
Cuts in college Pell Grants that will grow to more than $1,000 per year.
So we do bring college Pell Grants back to where they were because this program is growing at an unsustainable rate. It was increased so much that we've also learned that this is translating into tuition inflation. Every time we increase Pell Grants, what we find happens is tuition increases go up. So you're putting you're putting a dollar into one student's pocket, and then the government or the college is taking another dollar out of that pocket through higher tuition. We want to get at the root cause of education inflation. We don't want to keep financing education inflation, and we want this Pell Grant program to get growing toward a more sustainable rate because right now it's not sustainable.
It says that 10 years from now, if you're a 65-year-old who's eligible for Medicare, you should have to pay nearly $6,400 more than you would today.
First of all, if you're 55 and above, no change occurs in Medicare for anybody above the age of 55. That's quite different than what the president's proposing with his IPAB board. Second of all, what the Congressional Budget Office did not mention in that analysis is that if you're a low-income person, you'll get an additional $700 to $800 on top of what you would otherwise get to cover your out-of-pocket expenses. What this analysis does, and they mention this in a few sentences later, is they measure this Medicare reform plan against the status quo, but the status quo is unsustainable. Measuring against an unsustainable status quo is really a fiscal fantasy. Even the president acknowledges that Medicare can't keep growing at the rate that it's growing at in the future. We change that, but we do it by giving people more choice and more power to select their health care plans, government-approved plans that government regulate and people get to choose. It works just like the kind of a premium support system members of Congress and federal employees have. Only we say give more to low-income and middle-income beneficiaries, more to people as their health condition deteriorates, and less to wealthy people. So it really depends on who you are. But the point is, when this new program were to begin, it would give seniors, on average, the exact per beneficiary payment that they would have otherwise gotten in the traditional Medicare program. That's how we designed the system in the first place.
It says instead of guaranteed health care, you will get a voucher. And if that voucher isn't worth enough to buy the insurance that's available in the open marketplace, well, tough luck. You're on your own.
The president himself knows that that's not true. First of all, it's not a voucher. A voucher is, as the president would say, you give a person money, they go out into the marketplace and buy something. That's not what we're talking about. Medicare will have Medicare-approved plans just like it works today, whether it's Medicare supplemental coverage, whether it's Medicare Advantage, whether it would work like the Medicare Part D benefit. Medicare has years of experience of providing comprehensive health coverage plans that are private and compete against each other for Medicare beneficiaries' business. A person cannot be discriminated against based upon who they are or how sick they are. If Medicare offers the plan, they have to take everybody. This is a plan that they will select, and then Medicare will subsidize their plan. More if they're poor, more if they're sick, less if they're wealthy. This does not work in any way, shape, or form like what the president is suggesting, and this is why the term demagoguery is thrown around by the president's rhetoric. This is why people in the past have decided not to take on these reforms, because other irresponsible politicians will turn this into a political weapon and use them against them to scare seniors in the next election. You know, the truth of the matter is this Medicare reform idea we have is the one we got from President Clinton's National Bipartisan Commission to Save Medicare. It's basically the same kind of plan they recommended. It's a plan that has had Democratic backing in the past. And unfortunately, it's becoming politicized because I think the president has decided more toward trying to use this as a political weapon against Republicans, scaring seniors, and to discover or to disguise the fact that he wants this board of 15 people he will appoint to make the decisions in Medicare instead of giving future seniors the ability to make the decisions for their own care.
It's a vision that says up to 50 million Americans have to lose their health insurance in order for us to reduce the deficit.
So the president is suggesting that if we repeal Obamacare, his law, then we don't want to have people who have no insurance get insurance. We believe that you can have universal access to affordable health care coverage. You can have a system where people do not go without health insurance, but we don't believe the government has to take it over. Many of us have suggested and introduced legislation that accomplishes the goal of getting everybody with fundamental basic health insurance, even people with pre-existing conditions, that are affordable without a government takeover. And so, yes, we do propose to repeal the president's health care law. And that means we will not provide insurance for Americans the way in which the president intends to do so. That doesn't mean we don't want to fix this problem. That, quite to the contrary. Healthcare does need to get fixed. It's the biggest driver of our debt problems. We just believe we should do it in a far different way than what he's proposing.
Congressman Ryan says his plan, the path to prosperity, follows a basic philosophy.
The path to prosperity means stop spending money we don't have, get our borrowing under control, have fundamental tax reform and other things like an energy security policy to get economic growth and job creation in this country, to get American prosperity back, to get us back to being prosperous, to reattach the founding ideas to our problems, re-embrace American exceptionalism, basically. And if we do this now, we think we can fix this problem. If we keep kicking the can down the road, if we keep making more empty promises to people, then everybody's going to get hurt.
For the MacIver Institute, I'm Bill Osmolsky.